Hi, I'm going to be answering some questions for the assignment, and we have Honey here who will be helping us with our questions and our Chinese medicine physical exam. So the first question is listening, and what am I listening for in a Chinese medicine examination? Giving an example of what noise I might hear in a patient. So listening is listening to the owner's history, getting clues about what the dog is doing at home. So you ask them various questions to get a good history and a better understanding of the problem. So listening to history, Honey doesn't have any outstanding problems at the moment. She has had a knee issue in the past, but that's not flared up since, and she's going very well. She sleeps well. She does have some vivid dreaming sometimes, but she doesn't have any vomiting or diarrhea, and she doesn't pan excessively, although she does like to seek the sun, so she likes to sleep in a warm spot. Other things we can listen to is the noises they make, but also if they're on any medication, how they respond to the medication. So things like what their bark sounds like, what their purr sounds like. Is there any borborygmi? So you can take your stethoscope and have a listen to her tummy. And I can hear some normal gut sounds of Honey. Number two, so what are we smelling in a Chinese medicine examination? And so smelling can be what the smell of the skin is, ears and mouth. If they have a urine sample, you can smell the urine sample as well. So sometimes halitosis, so smelly mouth can be an indication of damp heat. And in this case, Honey doesn't have a bad breath, so her teeth smelling, and not any excessive, sorry about that, not any excessive bad breath. Number three, palpating. What are we palpating in a patient? So we can palpate pulses. That is something that's very important in giving us clues to the circulation and potentially some diseases in the patient. And usually we palpate with the femoral artery. So on Honey, it's a little bit tricky when she's lying down, but in here, I can feel her pulses quite well. There is a strong tone, and it's when I press it down, I can still feel the pulse, so it's not easily compressed, and it feels quite normal, and the heart rate is normal because she's looking quite relaxed. Other things you can do comes with experience, but you can do a manual thermal diagnosis, so you can run your hand along the dog and feel for any warm points. With Honey, it's a little bit difficult because she's quite fluffy, but you can run your hand, not touching the dog, but just around the spinal area, if there's any spinal pain, and just feeling for any spots that might be a little bit warmer. You can also feel for active points in a dog, potentially a little bit less hairy than her, but that does take a little bit of skill as well. So when I was feeling for any warm points around it, that was her bladder channel along her back, just for an example. So with the pulse, an example of a deep, weak pulse, along with it being a bit wiry, may indicate some spleen qi deficiency. And another example is when we are palpating potentially for splenomegaly, so when we're palpating the pulses, sometimes it can be felt with a wiry pulse. Alright, so next would be looking. So what are we looking for in a Chinese medicine exam? And we're looking for the dog's behavior, how it's behaving in consult relative to other dogs, because they will be potentially stressed if you compare it to how they behave at home, so relative to your other patients, how they're behaving. And quite importantly, look for their tongue color and shape as well. So the tongue will give you a lot of clues. For example, a red tongue may indicate heat, a swollen tongue with some depressions on the side or tooth marks may indicate a damp condition. So with Honey, I've looked at her tongue and it looks like a normal pink color. It's not too thin, and there's no excessive coating on it. So because Honey is a very good dog, I can easily open her mouth and I can see her tongue there. Good girl. But if a patient doesn't want to do that, or if it's a bit dangerous, because you don't know the dog, you can get them to lick something, or when they pant, you can look at their tongue as it's flicking out. So pulses, so listing 4 features of a pulse exam. So the pulses would be pulse traits being depth, the vessel diameter, force, and the tone. And for example, a wiry pulse is one that is not easy to compress, and it's firm and thin with a bit of tension like a guitar string, and it may indicate something like a triple heater, obstruction, or stagnation. Another example is a slippery pulse, which is easy to compress and it quote-unquote rolls away under your finger, and this may indicate a damp condition. So lastly, tongue. It says list 4 features you assess in a tongue examination. So the features that we'll be focusing on would be tongue color, which can be pale red, pale lavender, purple, dark red, or bluish purple. The tongue shape, which can be a thin tongue, a swollen tongue, whether it's stiff or very flaccid, flopping out of the mouth. Coating, so whether or not the coating is a normal coating, which can be just a little bit of whiteness, whether it's a thick white coating or whether there's yellowness on the coating. Cracks and moisture, so I actually have 5 to list. So cracks, horizontal or deep vertical cracks along the tongue, and moisture, whether or not it's too wet or too dry, or there's very sticky phlegm. So interpreting the colors, a patient with a pale tongue may be qi or yang or blood deficient, and a patient with a red tongue may indicate heat in the body. So that's all the questions that I've answered for the assignment. Thanks, Honey, for helping me. She's been a very good patient.